Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing health care to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Understanding TIAs, Recognizing Warning Signs and Preventing Strokes, presented by Dr. Prabhjot Khalsa, neurologist with Washington Hospital Healthcare System. Dr. Khalsa is a neurologist, neurointensivist, and co-medical director of the Washington Hospital Stroke Program. He has been with Washington Hospital for over 27 years. Dr. Khalsa is a member of the American Academy of Neurology and Neuromuscular and Electrodiagnostic Medicine. And now, please welcome Dr. Khalsa.
Hello. Today we'll be talking about TIAs, recognizing warning signs of a stroke and preventing strokes. Let's start with talking about the human brain. Human brain is the central organ of the human nervous system. It controls both motor and sensory functions throughout your body. It helps you receive and interpret information from your senses, including eyes, ears, nose, etc. It's responsible for thinking, remembering, understanding, planning, reasoning, and problem solving. Despite its small size, it's the most complex organ in your body. It's made up of billions of neurons that communicate through synapses, which are connections between neurons. It reaches its maximal size by 18 years of age. It constantly changes and adapts to new experiences and challenges. With regards to what is a TIA or a stroke, a TIA, also termed as a mini stroke, is a transient ischemic attack. It's a brief episode of neurologic dysfunction that's caused by temporary disruption of blood supply to the brain. A stroke occurs when the blood vessel bringing blood to the brain gets blocked or ruptures. The affected part of the brain doesn't get the oxygen and nutrients it needs, causing the brain cells to die. Brain injury from stroke can affect ability to move, feel, think, and behave. A TIA or a stroke is a medical emergency. Immediate treatment may minimize the long-term effects of a stroke and even prevent death. Let's go over a few stroke facts. A stroke is a brain attack, just like a myocardial infarction is a heart attack. Although stroke is more common after the age of 55, it can also happen at any age and at any time. It's the leading cause of adult disability. Some people who have a stroke will make a full recovery, but more than 2/3 of the survivors will have some type of disability. Every 40 seconds, someone in the US has a stroke. 2 million brain cells die every minute during a stroke. How common is stroke? Stroke has large impact on our society, with more than 9 million stroke survivors in the US at this time. Every year, about 800,000 people in the US have a stroke, with about 185,000 being recurrent strokes. Stroke is the 5th leading cause of death in the US. It's the 3rd leading cause of death in women. About 55,000 more women than men have a stroke each year. Black people are twice as likely as white people to have a first-time stroke. Treatment may reduce the effects of stroke if treatment is administered soon after the onset of symptoms. About 80% of strokes may be prevented with lifestyle changes. Let's go over the types of strokes. The most common type of stroke is ischemic stroke. It accounts for about 87% of strokes. An ischemic stroke occurs when a clot blocks the blood vessels supplying blood to the brain. The artery becomes narrowed or clogged, cutting off blood supply to the brain cells. If the disruption of blood supply is temporary, we consider that a TIA, or a mini stroke. Unless proven otherwise, all TIAs should be evaluated as potential strokes. The other type of stroke is hemorrhagic stroke. A hemorrhagic stroke happens when a blood vessel bursts or ruptures in the brain. This type of stroke may affect large arteries in the brain or small blood vessels deep within the brain. The rupture keeps the surrounding areas of the brain from getting enough oxygen. Hemorrhagic strokes are less common than ischemic strokes. They account for about 13% of strokes. However, they're associated with a higher risk of death. Transient ischemic attack is a temporary blockage of blood flow to the brain. The clot usually dissolves on its own or gets dislodged. TIAs produce symptoms just like a stroke, but typically last a shorter amount of time. While a TIA does not cause permanent damage, it's a warning stroke, signaling a possible full-blown stroke ahead. A TIA's temporary symptoms make diagnosis challenging. Stroke symptoms that disappear in under an hour still need emergency assessment, and a comprehensive evaluation should be done within 24 hours. Here's what you can expect if you go to the emergency room for evaluation of a stroke. Your symptoms and medical history will be assessed. There may be imaging of the blood vessels in the head and neck. Other testing such as CAT scan of the head, cerebral angiography, CT angiography, or an MRI scan of brain may be done. Once the TIA is diagnosed, a follow-up visit with a neurologist is recommended to assess the risk of future strokes. Let's go over the acronym FAST. FAST is an acronym used to spot symptoms of a stroke. The F stands for the face. So does one side of the face droop or is it numb? You should ask the person to smile. If the person's smile is uneven, that's a symptom or a warning sign of a stroke. A is for arm. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downwards? This may be a sign of a stroke that's impending. Speech. S is for speech. Ask the person to repeat a simple phrase. Is the speech slurred or strange? This may be a sign of a stroke. T is for time. Time is extremely important. If you observe any of these signs, call 911 immediately. Note the time when any of the symptoms first appear, which may be important when you arrive in the emergency room and the doctor may ask you what time the symptoms started. Other symptoms of stroke may include sudden onset of numbness, weakness of the face, arm or leg, especially on one side of the body. Other symptoms may include confusion, trouble speaking or understanding speech, understanding what is being said to the patient, trouble seeing in both or one eye, trouble walking, symptoms of dizziness, loss of balance or coordination, or a severe headache with no known cause. One needs to act quickly. If you experience one or more of these symptoms described above, or notice them in someone else, even for a short time, you need to call 911 immediately. Medical options may reduce the effects of stroke. Time is of great importance, as treatment must be administered soon after the onset of symptoms. Stroke strikes quickly. You should too. Why you must learn to recognize stroke symptoms. You need to learn the acronym FAST. To save lives, this acronym is easy to remember, it's easy to teach, and requires quick action. Effects of stroke depend on various factors. It depends on the region of the brain that's affected. It depends on the size of the area that's damaged by the stroke. It depends on functions that the damaged area controls. In terms of how a stroke can affect you, a stroke on the left side of your brain affects the right side of the body, and you may experience some difficulties with weakness and sensation on the right side of the body, opposite side of the body, speech and language difficulties, which we refer to as aphasia, inability to read, write, or learn new information. Patient may experience reduced ability to do math, reason, and analyze, and there may be memory loss. Strokes affecting the right side of the brain affect the left side of the body, and patient may experience difficulties with weakness and loss of sensation involving the left side of the body. There may be difficulties with depth perception or directions. Patient may experience vision problems. There may be inability to paint, appreciate art and music. Patient may have lack of ability to recognize emotions and voice. There also may be memory loss. Stroke risk factors. Let's go over risk factors that cannot be controlled. One of these is age. While strokes can occur at any age, the risk increases after the age of 55. Patients may have family history of stroke. This is a factor that can't be controlled. Strokes appear to have a genetic link. You may face a higher risk of stroke if an immediate family member has had a stroke. Race and ethnicity may affect your risk for stroke. Black people have higher prevalence of stroke and a higher death rate from stroke than any other racial group. Gender. Women have a lower risk than men before menopause, but more women than men die of stroke. If you've had a previous stroke or transient ischemic attack, that increases your risk for having a stroke. A person who's had a TIA has more likelihood of having a stroke than someone of the same age and sex who hasn't. If you've had a stroke, it means you're at a greater risk for having another stroke. Almost 1 in 4 of patients who've had a prior stroke will experience a recurrent stroke within the next 5 years. Medical risk factors for stroke include high blood pressure. Measurement of blood pressure greater than 120/80 is considered high. You need to work with your healthcare professional to manage your blood pressure to prevent this risk. Diabetes. Having diabetes more than doubles your risk of stroke. High blood glucose increases plaque buildup and damage in your arteries. Cholesterol increases the buildup of fatty deposits in the artery walls. Circulation problems. Patients who have other circulation problems are also at higher risk for developing stroke. Atrial fibrillation is also a risk factor for stroke. It increases the stroke risk by 5-fold. Lifestyle risk factors that can increase your risk for stroke include tobacco and vaping. Current smokers have 2 to 4 times increased risk of stroke compared with non-smokers. Alcohol is a risk factor for stroke. So eliminating or reducing alcohol use will decrease your risk for stroke. Heavy drinking can increase your risk for stroke many-fold. Obesity is a risk factor for stroke, so maintaining a healthy weight is extremely important. Physical activity can help reduce stroke risk. A brisk 30-minute walk each day can improve daily health. Eating a healthy diet reduces your risk for stroke. It's recommended that one eat a diet rich in fresh fruit, vegetables, whole grains. The diet should include a variety of proteins. One should minimize processed foods. One should limit salt intake. One should limit intake of added sugars and also avoid fried foods. Stroke or TIA diagnosis. In case of a stroke, diagnosis will help determine the type of stroke or TIA and help determine its treatment. In the emergency room, the stroke team may ask you when your symptoms of stroke started. This is critical in determining the best treatment. They may ask you about your medical history. They may do a physical and neurologic examination. They may order certain blood tests. They may also order a CAT scan of the head or MRI scan of the brain to determine what kind of stroke a person has had. Life's Essential 8 is your checklist for lifelong good health. Better cardiovascular health helps lower the risk of heart disease, stroke, and other major health problems. Number 1, you need to eat better. Aim for overall healthy eating pattern that includes whole foods, lots of fruits and vegetables, lean protein, nuts, seeds, and cooking in non-tropical oils such as olive and canola oils. Number 2, be more active. Adults should get 2.5 hours of moderate or 75 minutes of vigorous physical activity per week. Number 3, quit tobacco. Use of inhaled nicotine delivery products, which include cigarettes, e-cigarettes, and vaping, is the leading cause of preventable death in the U.S. Number 4, get healthy sleep. Most adults need 7 to 9 hours of sleep each night. Adequate sleep promotes healing, improves brain function, and reduces the risk for chronic diseases. Number 5, manage your weight. Achieving and maintaining a healthy weight has many benefits. Losing as little as 5 to 10 pounds can make a significant difference in your risk for stroke or heart disease. Number 6, control your cholesterol. High levels of LDL or bad cholesterol can lead to heart disease. Large amounts of cholesterol in the blood can build up and cause blood clots, leading to a stroke. Number 7, manage your blood sugar. Most of the food we eat is turned into glucose or blood sugar that our bodies use as energy. Over time, high levels of blood sugar can damage your heart, kidneys, eyes, and nerves. Number 8, manage your blood pressure. Levels less than 120/80 are optimal. High blood pressure or hypertension is the leading cause of stroke and the most significant controllable risk factor for preventing stroke. More tips to be healthier and reduce your risk of stroke. Take your medications as directed by your doctor. Reduce stress, which may contribute to behaviors such as overeating, lack of physical activity, and unhealthy diet and smoking. One should also have regular medical checkups, including assessment of your stroke risk factors. You should see your medical doctor and have medical checkups regularly. That's the end of my presentation. If you have any questions, I'll be happy to answer them.
Thank you, Dr. Khalsa. We do have a couple of questions. The first question is it possible to have a TIA and not be aware of it?
One can have a TIA. There are silent parts of your brain where you may be affected by lack of blood supply and not even have any symptoms. So if you suspect you're having symptoms or sensations that may represent a TIA, you should see your doctor.
Okay, thank you. And the last question we have is, are there screenings for stroke risk?
Yes, there are. You should see your medical doctor and have them do medical checkups, including checking your labs for diabetes, labs for your cholesterol, LDL, and you should also have your blood pressure checked on a regular basis.
Okay, thank you, Dr. Khalsa, for this insightful presentation. This does conclude our program. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.